let's talk about dental extractions. So, you may be wondering, why would you need a dental extraction? Well, some indications for extracting teeth are severe bone loss around teeth, which you can notice by the tooth shaking very badly. If the tooth is impacted, severely decayed teeth that are deemed unrestorable, trauma injury causing fracture that cannot be filled, and to relieve crowding after treatment planning with an orthodontist. There are two types of dental extractions: surgical extractions and non-surgical extractions. In a non-surgical extraction, this is where there is enough sound tooth structure above the level of the bone, allowing us to apply a dental forcep to remove the tooth. As you can see here, this tooth here has a lot of sound tooth structure above the level of the bone, which is here, which makes it a good candidate for a non-surgical extraction. Whereas this tooth here, see how badly broken down it is and close to the level of the bone, this would most likely not be extracted by a non-surgical extraction. Just to show, as you can see here, we have the tooth, a lot of sound structure. The level of the bone is here. This is the dental forcep coming in here, gets the tooth, takes it out, right? Non-surgical. In the case of a surgical extraction, right, this would be where there's not enough sound tooth structure above the level of the bone. We would have to use a dental handpiece like this, and we would either one of two things, or it could be a mixture of both. We would remove some of the supporting bone around the tooth, which would then allow us to apply the forceps to the tooth and extract it, or we could section the tooth into pieces. So we can divide this into two pieces and then take this half out and this half out. Right? After an extraction is done, it is normal to experience minor bleeding, pain, and swelling. These are all side effects of extractions. Let's talk about bleeding. To help with bleeding, you would be provided with some cotton gauze, which you would take and place over the extraction site like so. And then you would be asked to bite down firmly on it in order to apply pressure to stop the blood from coming out of the socket. This would help to achieve a blood clot. A blood clot usually forms within 6 to 12 hours. It is normal to see some blood oozing out, depending on the extraction. If it was a surgical or a non-surgical, right, appropriate painkillers would be prescribed to you to make you as comfortable as possible. Now let's talk about swelling. Swelling is more noticeable after a surgical extraction. Swelling will begin at 12 to 24 hours after an extraction and reach its peak at 48 to 72 hours. And then it would start to subside and you'd notice it going down. By use of a ice pack and apply it to the area where the extraction was on your face, this would help to greatly reduce the amount of swelling, as well as sleeping with your head elevated. After an extraction, there are some instructions that you must follow. These are known as post-operative instructions, which are: don't spit, don't perform any strenuous activity, don't drink anything from a straw or suck anything, don't drink any alcoholic beverages, and don't smoke. Also, take your medication as prescribed. In 24 hours, you can rinse with some warm salt water twice a day for the week, which would help the area to heal nicely. And the gauze that we talked about earlier is to be kept in the mouth for 30 minutes and then after 30 minutes after the extraction, and then removed and thrown away. These instructions are to prevent the loss of a blood clot, which would result in something known as alveolar osteitis, or a dry socket. If this occurs, you will experience bad throbbing pains for 3 to 5 days after an extraction. It is, however, a self-limiting condition, which is to say that it will go away on its own, but if the pain is too severe, you can return and have it treated. Some causes of persistent pain after an extraction would be fracture of the alveolar plate, adjacent teeth with symptoms, trismus, which is a muscle spasm associated with the TMJ or the jaw joint, a fractured jaw, a dry socket as we previously discussed. If you'd like more information on this topic, you can call the number listed below or message. Thank you.